Hi, everyone. Welcome back to The Social Mind. Today, we're talking about the importance of exercise for health and well being. Now, according to the CDC, the Center for Disease Control, regular physical activity is one of the most important things you can do for your health. Being physically active can improve your brain health, help manage weight, reduce the risk of diseases, strengthen bones and muscles, and improve your ability to do everyday activities. The Center of Disease Control also states that adults need about 150 minutes of exercise per week, which roughly is about 30 minutes per day. This can be moderate to intense physical activities that should include 2 days of muscle training or strengthening activities. I have with me today on the social mind my friend and colleague, Mr. Troy Felix, who is an athlete and a personal trainer, to talk to us today about the importance of exercise for our overall health and well being. Troy, welcome to the social mind. And before we get started, is there anything that you want to share with the audience about yourself?
Um, Hello, everybody. Um, Welcome to the Social Mind. um, Really, it's a privilege for me to be here. I'm really happy to have gotten the invitation. A little bit about me, as our host would have said, I am a personal trainer and athlete. I represented Grenada in the sport of cycling for 20 plus years. I'm also a triathlete, represented Grenada then in triathlon as well. And fitness is generally my thing. Might go out on a limb to say that I'm addicted to exercise. Regardless
You
to
are.
what my day look like, I will try to get something in. All right. Um, that is very beneficial. I could go ahead and say that. All right.
Okay, try. So again, guys, remember we're talking about exercise, and there are a variety of exercises that one can do to stay fit and healthy. Troy, what are the different types of exercises? Can you tell us what are the different types of exercises that one can choose based on probably their age, their, let's say if they have any health problems and so on. There are different levels and different types of exercises that one can do. What are some of these?
All right. No, exercises are wide range. All right. No, we have low impact exercises. We have high impact exercise, of course. We have strength exercises, strength training. We have flexibility exercises. Um, we have exercise that improves your balance and your agility. So there are many aspects to that, many components to that exercise and fitness. You know, um, for example, somebody who may have issues with, let's say, osteoporosis. That's when you start losing your bone density.
That's it.
While while we have to be very careful how we do it, but some form of impact exercise would be great because impact exercise actually helps to improve or um, maintain bone density. That's just one example of one of the one type of exercise that could be done. Yeah.
Okay, so can you discuss like the benefits? You mentioned strength training and so on, and the other types of exercises that one can do. Can you discuss the benefits of, I suppose, each of these exercises? And I mean, you just give us an example, and can you explain them?
Okay,
For
sure.
example,
So let's
yeah,
say let's say
sorry.
we start with the low impact exercise. Now, some people have restrictions as to what they could and cannot do. All right. Um, Low impact exercise is suitable for almost everyone. Okay. Example of low impact exercise. One of the most um, chosen one is swimming. Swimming is like the lowest impact exercise you can have. Okay. Moving on to that, we have cycling, which is my sport, and we have things like yoga. All right. Now, Yoga in itself shares with the different types of exercise because yoga helps to promote flexibility and mobility. All right. And then it falls into the bracket of very low impact exercises, except you're going to do, you know, impact yoga. But yes. So moving on from that, we have the high impact exercise, which we would like, which we would do if we have the issue of trying to improve and maintain the bone density, or if you're trying to get um, your heart rate up. Okay, so we could move on to HIIT, high intensity interval training. That would get your heart rate going. That would give you some good, um, a good pump, and you get a good sweat. Not that I do get sweat from other exercises, but once you start with a HIIT, you know sweat is coming. Yeah. Then we have alongside HIIT could come something like agility, the agility exercise. And while it might be, how do I say this? While it might be overlooked, agility is something that we need to actually focus on and incorporate into our everyday exercise. And that would actually have you prepared for a unplanned situation. For example, something happened and you had to move real quick. The body knows how to do that already. It's not like a shock to the body, you know. So Lauderdale, you're one of my clients, so you know. Sometimes we do, when I say do the step knee lifting, that's actually one of the agility exercises. Step
Agility
to the left, lift
exercises.
the knee. Step to the right, lift the knee. Go back and forth, do wide football runs. All these are exercises that have you thinking on your feet and ready to move left, right, back, forth. You know, um, outside of that, you have what a lot of people turn to when they say exercise, and that is strength training, especially males. You find a lot of males, you would ask them, do you exercise? And they say, yeah, I was going to the gym, you know? And you ask them, what do you do at the gym? Well, I lift weights. But to some extent, that's just one component of the exercise, of the fitness. They lift weight, yes, they're very strong, but ask them to touch their toes, and then you see they lack in flexibility. All right, which is
Right.
very important component of fitness. You know, so we should try to focus as much on a wide base fitness instead of just, let's say, for example, strength training or um, cardio and so forth, right? We should try to make exercise, like for example, your warm up, you should try to do a lot of your mobility exercises there. Try to get the body ready for exercise, ready to move. Yeah. And that would eventually help your flexibility later on. One of the easiest ways to check parts of your flexibility is to touch your toes. A lot of people cannot touch their toes without bending their knees. Yeah. Um, Another one is to try washing your back without your back scrubber. Use your rag and your hand to wash your back. See what happens to your non-dominant hand. For example, you may be able to wash your back, for example, with your left hand. And if you try to do it with your right hand, you realize your right hand don't even get half as far as your left hand. And that is your right hand lacking some form of flexibility. Yeah?
Absolutely, absolutely. So, you mentioned that we should try to get some form of physical exercise. If you go into the gym, we have to be doing the flexibility and so forth, right? Not just lifting weights. So, from your experience as a coach and trainer, what do you think it is so hard for people to, I suppose, to have a schedule where they put in exercise as they would do anything else? You know, we have to sleep, you have to eat, you have to go to work. What do you think is hard that we sometimes fall off that wagon as humans, as much as we would like to, from your experience as a coach?
All right. So I could answer that in one word, but I wouldn't. I'll say the one word, but then I'll go on to speak a little more. Priorities. Simple. All right. No,
Okay.
you, we should make exercise a priority. The reason for that is exercise promotes your health. All right. So, for example, you decided that you wasn't going to exercise this morning because X, whatever the reason was. It wasn't physical activity. All right. You was too tired. You have an early appointment and whatever. And exercise got thrown under the rug, as you would say. Now, life happens. All right. But we have 24 hours in the day. And be it half an hour of your lunchtime. And yes, you had a bed and everything after. So you have an hour for lunch and half an hour of your lunchtime. In the worst case scenario, you could dedicate that to exercise. All right. Now, I said life happens before, and I said priorities before. Um, Consider your exercise regime part of your life. Just how you wake up, you breathe, you eat, consider exercise as important as. Okay? So
Right.
we shouldn't let 2 days pass when we didn't do something, some form of physical activity, be it some breathing exercises. All right? Sitting in your chair, taking long, deep breaths. While you're sitting at your desk, you're pointing and flex your feet, rotating your ankles, whatever is something. Movement is important. All right?
So is there a specific time you think one should exercise? Like a particular time of the day?
The only reason I'm going to say a time is because the day can run away with us. So maybe if you get it out of the way first thing in the morning,
Right.
that might be best. But um, as a personal trainer, I've met clients who say to me, "I'm not a morning person." So they wake
Right.
up. They don't wake up at 100. They wake up at 50. So they don't feel to exercise. They don't have that drive. They don't have the energy. But later on, they're ready to go. So if you are a
Right.
morning person, get it done early. If not, if you're more energetic in the evening, then make sure you make the time. Set an alarm on your phone. This is time for Lauderdale to exercise. Okay? At 2:45, you
Right.
know your exercise is 3:30. 2:45, your alarm goes, and let's start wrapping up what we're doing so that I could
Right.
exercise at 3:30. And that would help us, to keep our regime going, to keep our exercise plan in place.
Absolutely. Well, I am a morning person, as you know, and so I prefer to get it out of the way simply because the rest of the day, a number of things can happen and you could get tied up, and then your energy level drains. And after a particular time in the day, my energy level is at zero. So you're absolutely right. Some persons are morning persons, some persons just function better in the evening. If I have to do, let's say, strength training, that would be in the morning for me. If I just have to do some form of, let's say, cardio, which is walking in the evening, that's fine for me too. But I guess you have to pick what works for you. In essence, that's what you're saying. Yeah.
Yep. Also, some people bodies react different to exercise. For example, somebody or some people will exercise in the morning and their day will be they will be slow for the day. All right. And some people will exercise in the morning and then they're jumping. So
Right.
maybe for the people that feel really sluggish and really tired, maybe they are afternoon people, they are evening people. So after exercise, maybe shower and go to bed. That's your
Right.
that's your pathway to sleep, to good sleep. you know.
Right.
Whereas with some people, they exercise and they feel they happy, they good, and that's them opening the door with having a perfect day. So
Right.
we have find yourself,
You have to find
and
that
yeah, make it
balance.
yeah, make it happen, but make it happen.
Absolutely. That the evening exercise will keep me going. and I won't be able to sleep. So morning works for me because then I can go at that particular time and get everything done. But the evening would give you a extra boost of energy that sometimes one can have problems sleeping. So you absolutely right. Find that balance, right? So we've been talking about the different types of exercises. Now, you mentioned some in between, but I want you to probably elaborate some more and tell us what are some of the benefits of exercising, and I suppose exercising consistently.
Oh, well, that's a good question. So the benefit of exercise is so much. Heart health, yeah, good heart health. I mean, general well-being. When your sweat pores clean out, your endorphins on a roll. You know that happy drug that the body produces when you do exercise.
Exercise, right?
General health, weight control, you know, cholesterol control. If you go to the doctor, your cholesterol high, they tell you cut certain foods and exercise. You know,
Exercise.
so the benefit of exercise is wide, is a lot. General, it is a lot. I mean,
Right.
from keeping your weight under control to keeping your mood in check, you know, keeping you smiling, it is a lot. There are very little disadvantage of exercise.
I
And that
suppose
leads me to
you're preempting my next question. So tell us
so
the
that leads me
advantages
to
and disadvantages of exercising.
yeah, generally a disadvantage of exercise is not something that I would like note, but I would say that people need guidance, especially at the beginning of the exercise regime. All right.
Right.
So, and I see it happen. Some clients end up by me, and what I would hear is that the doctor tell me I'm overweight or some complication, so I started exercising. Now, the person would have
Right.
started exercising too much, too quickly, without guidance, so they end up with an injury. All right, and then they end up by the physio. The physio direct them to a trainer, and that's how I would hear the story. So
Right.
one of the disadvantages is maybe doing too much too soon, too quickly. And that is pushed on by the fact that people get scared when they hear of health complications. And when they're advised to exercise, they just jump in. They might jump onto one of the internet pages and see somebody doing an exercise and they do it. Sometimes the exercise might be too intense for them because they're carrying
They're
too much
just
weight to
starting.
do that kind of exercise,
Right.
or it doesn't go along with their body type. And there's certain exercises you don't want to do, especially if you're on the heavier side. You know, you don't want to be jumping too much because remember, if your bone structure is not adequate for the amount of weight you're carrying on it, adding a jump to it could be a disadvantage. All right.
Right.
So something else I want to touch on when it comes to that exercising and disadvantage. I keep doing this for disadvantage because we could only recover from, we could only benefit, sorry, from exercise we could recover from. Okay?
Right.
Example, I would use me as an example. A cyclist, if I go out and do 3 hour ride, right? I would need maybe 20 hours to recover. Somebody else might need less, somebody else might need more. But let's say I didn't get that adequate recovery time and I jump in and do another block of exercise. I am one not able to make the same effort that I'm targeting, and that way my exercise, my workout is compromised, and so forth. Now, had I taken the adequate recovery time, I would have been able to make that effort and benefit from it. Okay, so Lorna Dale,
Right.
I'm going back to you again. While we're in the studio, you would have a block of exercise and you would have a period of rest, and that's exactly where I'm going with that. While my
Right.
rest time for a 2 hour, 3 hour ride would be longer, you would be getting your adequate rest to be able to do your effort again over
For
and
the second block.
over and rest, and
Right.
we with you again, you realize that most times the intensity of our workout go from here and it goes to here. All
Downhill.
right.
Yeah.
So, and that is again being able to recover from what you would have done. Yeah. So we have to be careful how we go about the exercises, how we go about exercising, and take recovery and nutrition into account or consider it heavily when we exercising and after we finish exercising.
How about someone who works out excessively? What when I say that, what I mean is I excessively, because you remember I was doing it at one point in time. I doing it in the morning, I doing it in the evening, and you lose the weight drastically. You probably build muscles drastically. Is there an advantages to your body in those cases?
Um,
Excessive workouts.
so your exercise has to be again coupled with rest and nutrition. Okay, so depending on how you got to that excessively phase, you may still be safe to a certain point. Because if you would have started here and you build to that where you can do that much exercise, you might still be safe once you're getting enough rest to recover and you're putting in enough nutrition. You also need to listen to your body when it comes to signs of injury. Okay? So we have to be careful how we go about it. There is something as too much exercise. Your body
Right.
will start getting tired, your day to day would be affected, and that's signs that we would be able to see. For example, typical example, you. Let's say we're having this program and you start falling asleep on your program. That's not a good sign. You understand? So that
That's not
might
going
be
to
a
happen.
sign that you've overdone it or you're overdoing it. So maybe it's time to pull back a little bit, take an extra hour, tailor your 2 a days. And I'm saying 2 a days as in you could exercise twice for the day. You could exercise in the morning and exercise in the evening. But those 2 a days should be 2 days, at least 2 days apart. So you shouldn't do it every day. You understand? So while
Guilty.
yes, you would build to that fitness, we still wanna be very careful how we load the body, how much
Body.
stress we put the body under. You know, while yes, again we want to have adequate nutrition and rest, we have to be careful again with how much we do. And a lot of it, everybody's different. Some people can handle it and be fine, and then some people they would see benefits for a while, then they plateau, and then they start having injuries. They start falling asleep on the camera and so forth. Yeah.
Are you trying to try? Uh, no. As we wrap up, right? Is there anything that you want to share with the audience about the importance of exercise for our overall health and well-being? I mean, anything that you might have seen in your line of work that we should pay attention to and should not? Anything you want to share?
um okay, so generally exercise is the way to go. um what I would suggest is speak to somebody, especially if you're starting out. Even if you're not starting out, if you're unsure about something, ask a question. Speak to somebody.
Right.
It makes sense to ask a question and get the proper advice or get advice from somebody who might know than to not ask. Don't speak to anybody. Start an exercise regime. Start off feeling really good and then get an injury and have to take 5 weeks off. All right. So my one of my advice would be to ask questions. If you're starting off, start off slowly. It's better to do too little than too much at first.
Too
It's
much.
better to start really low, really small, and build, build, build. All right. Also, depending on your reason for beginning to exercise, and I would go back to where I said some people get some challenging news from the doctor and they decide, okay, exercise is the way to go. Be sure to ask your doctor or ask him to refer you to somebody who would know where you should start or what's adequate, what's best for you given your condition. You know, so that's
Right.
one of the things too. Along with your exercise, you must pay attention to nutrition in whichever way you choose. And I say that because some people have different eating habits. For example, some people don't eat meat, some people don't use certain products, and so forth. And that's fine. But when you start an exercise regime, you put extra stress on your body. You need to be adequately nourished. So if it is you don't eat meat, or I'm just saying meat, but whatever it is you do not eat, you need to be able to get a supplement for it.
A substitute or something. Yeah.
Substitute, not supplement as in tablets or so. Something that would give you that necessary group that you may be missing due to your eating habit. All right?
Right.
Something that needs to be paid, attention needs to be paid to is your hydration, water, simple water. All right? Now, we should drink water throughout the day. Throughout the day. All right? So, some people, like I speak to clients and they have an issue drinking water. They can't drink water early in the morning or they can't drink water late at night, whatever the reason slash excuse is, you know. And I would say you need to drink at least, 7 glasses of water. And they'd be like, no, I
Right.
got a lot of water that was sitting in the toilet. That's good. Clean out your bladder. That's fine. So water is one of the things that's overlooked by a lot of people, but it should be part of your exercise regime. You should have your water with you um, throughout the day. Sip it. Squeeze a little lemon in it. Change the taste so you don't know it's water. Well, sip it, sip it. Whatever it is. Once it's not something like a sweetener or something, put something in it. Make it taste different,
Right.
but drink the water. Yeah, hydration is key, key, key. Imagine we going into the gym and do an hour exercise. We do an hour high intensity, so we sweat a whole lot. All right, and we decide we go home and we didn't drink water. We didn't drink water during the exercise. We didn't drink water after. That's not good. I mean, we need the water. We need to replace that water because we're losing it through the sweat. We will use the bathroom. That's water gone. So we want to keep that water regime going as well. I don't think there's anything else at the moment, but
Okay, then. All right, guys. Thank you, Troy, for being here with me today on the Social Mind. And remember, guys, as Troy pointed out, check with your doctor before starting any form of vigorous exercise. And bear in mind that some physical activity is better than none at all. And an active society is also a healthy society. Now, remember to share, like, and subscribe to the Social Mind on my Facebook page or on my YouTube channel at Lauderdale Charles. Um, Thank you, guys, and I would see you next week for another episode of the Social Mind. Thank you, Troy.
You're very welcome. It's a pleasure for me